Hi everyone, I want to highlight a new study published about GLP-1 medications and breast cancer. We've been talking a lot here about the fact that we are starting to see a signal about GLP-1 medications potentially being beneficial for breast cancer outcomes. In breast cancer, we don't know if that signal is due to the impact of the GLP-1 medications on weight loss, on changes in metabolic health, or probably a combination of both. We don't yet have any prospective data. So all of the data that we have is retrospective data, meaning researchers are looking back at charts to see who was on a GLP-1 and what were their cancer outcomes. There are several prospective studies that are currently accruing and recruiting patients, meaning they're putting patients on a GLP-1 and following them to see how they will do and whether the use of the GLP-1 will lower their risk of recurrence. Two of the studies that I am familiar with are FitWise and TRIM EBC, and so I'm really interested to see what those results will show. But I want to highlight a study that was just published in the journal JAMA Network Open. Let's talk about it. So this is a study, and it's looking at survival and recurrence with GLP-1s in patients with breast cancer. For this study, they pulled charts and records from the TriNetX US Collaborative Network database, which includes patients with breast cancer from 68 healthcare organizations, and these were women diagnosed between 2006 and 2023. And then they looked at patients who had 2 or more prescriptions for GLP-1 during either 6 months before their diagnosis or any time after their diagnosis. And their primary outcome was all-cause mortality or death from any cause, and then secondary outcome was recurrence-free survival, time that someone is alive without a breast cancer recurrence. They had 3 different cohorts, which I go into in the caption of this video if you want the details on it. But bottom line is they showed that when used for obesity, GLP-1 medications reduce the risk of all-cause mortality by 65% and recurrence by 56%. The benefits were actually even more pronounced when using GLP-1s for diabetes when compared to the use of insulin or metformin. I do want to stress that there are a lot of limitations to this study. We don't know if patients actually took the GLP-1, just that they had the prescription, how long they took it for. We don't know anything about their breast cancer diagnoses, treatment, stage, type, any of that. Patients with stage 4 breast cancer were not included in this study. Most of the GLP-1 medications used during this time period are rarely prescribed today, so something to keep in mind. And retrospective studies, while promising, are not definitive proof. So what do we take from this study? I think it adds to the growing body of literature that we have a signal that GLP-1 medications may be beneficial. However, this study does not tell us that GLP-1 medications on their own are a breast cancer treatment. For us to be able to say that we will need prospective data, which we are waiting for. I think this adds to the data that we can use GLP-1 medications in patients with breast cancer. And lastly, I'm asked a lot about microdosing or using GLP-1 medications outside of their current approved scope. And those are individualized and nuanced discussions that I will leave for patients to have with their medical teams. But I want to be very clear that this signal that we are seeing is in patients that are using GLP-1 medications for either diabetes or obesity. And we don't have data for any potential signal or benefit outside of those indications. Let me know what you think and any questions that you have.